What's the latest on the potentially new respiratory infections circulating in the United States? In this video, we'll go over the latest about what we need to do to contain this potentially new infectious disease, what steps we need to take to help find the answer, and I'll provide resources so that you can stay up to date. Most importantly, as this is time sensitive, currently the Kansas State Diagnostic Laboratory is doing gene sequencing from sick dogs at no charge until December 31st, 2023. A link to the submission form is in the description. The turnaround time for this test is 2 to 4 weeks. Gene sequencing is a way that they can actually break down the DNA and identify the organisms involved in the infections. Unfortunately, there are a lot of different organisms that are isolated. So getting all of this data and all of these dogs into these studies will help them find the cause of the infections. The gene sequencing is being offered at no charge until the end of December of 2023, but you also have to do a respiratory panel, which will rule out all other infectious diseases, and a culture, an aerobic culture, to see if there's a bacterial cause of the infection. If your dog is frequently exposed to other dogs, consider the para-influenza and Bordetella vaccinations. If you frequent dog shows or situations where you cannot avoid communal exposure, you really should talk to your vet also about the flu vaccination, although that is in short supply at this time. Again, look at your dog's risk factors. Discuss them with your veterinarian. If you have an extreme brachycephalic, these are things that you should definitely consider, or any dog with respiratory compromise such as collapsing trachea. It's important to remember that thousands of dogs will cough every month from these various infections. But now the media has everyone in a panic. Fear is spreading on social media faster than anything else to a society that is already traumatized by COVID and world events. Beware of misinformation, because I've seen plenty of it out there. Symptoms of atypical canine infectious respiratory disease, which is what we are calling this right now, is that these dogs may cough for 6 to 8 weeks. Some dogs will progress rapidly to a pneumonia that is unresponsive to the antibiotics typically used. It's possible that this is not even a bacterial infection, it's a viral infection, and that is the cause, and antibiotics will help with a secondary pneumonia, but again, we're not really even sure what we're dealing with. Some of these dogs may also have sneezing, ocular and nasal discharge. They may become lethargic and have a decreased appetite and fever. Many veterinarians are reporting dogs that are acutely struck with a pneumonia will have very pale gums, and this brings up a good point. Are you familiar with your dog's usual gum color? Maybe just make a habit of lifting up their lip and looking at their gum color so that you're aware of what is normal for your dog. Again, if you got an aggressive dog, I don't know if I'd be doing this, but it's always good to have an idea of what is normal. Diagnosing this syndrome involves a negative PCR test for the usual suspects in canine cough. There will also be a negative culture, and characteristics include the cough should go on for 6 to 8 weeks, and it may be acute, progressing rapidly to pneumonia and death. I think one of the most important take-homes here is that dogs have risk factors for getting sick rapidly from respiratory diseases. The usual dogs that we worry about and get pneumonia just from even kennel cough are your French bulldogs and other extreme brachycephalics, as we would say, the dogs with very short noses, and you often hear them coming because you can hear them breathing. There's also dogs that have compromised respiratory passages, say collapsing trachea or laryngeal paralysis. I'd worry about those dogs. Also seniors and dogs with chronic illness or cancer. The very young and immune compromised. These are the ones that we really need to look out for. Prevention is much easier, as we all know. Avoiding communal situations and instead making tweaks can keep our dogs safe. Avoid the dog park and daycare, boarding and grooming facilities, communal bowls, and stay away from dogs that frequent dog parks and daycare, especially if your dog has risk factors. Isolating at home is best. If your dog was potentially exposed, you'll want to stay away from all other dogs for 14 days. And if they were exposed and sick, 30 days. If your dog is sick with a cough, supportive care would include things like maintaining hydration with bone broth or like Grandma's chicken soup for dogs. and we will link to a video on that as well. You should feed dogs with a cough and potentially sore throat moist or wet food, or at least moisten their dry food. Give them rest, but have short bouts of movement, just enough for circulation and respiratory health. Also, obviously, you would isolate that dog and monitor their gum color. You might want to have a plastic thermometer on hand so that you can take your dog's temperature and monitor their activity level as well. You could soothe a cough with our slippery elm syrup recipe, and we will also link to that. Any prescriptions from your veterinarian, obviously, give those, but don't suppress a cough unless they advise you to do so, because you do not want to suppress a cough if your dog has potential pneumonia. Rely on your vet's guidance. Your vet can do the proper diagnostics and monitor your pet for pneumonia. Several bacterial and viral infections are implicated in canine respiratory infections. The usual suspects in approximate order of prevalence are canine cough, kennel cough, basically the equivalent of the common cold, circulating forever, which is basically Bordetella and parainfluenza. Other causes such as canine respiratory coronavirus, canine pneumovirus, canine influenza virus, strep zooepidemicus, mycoplasma, and, of course, combination infections involving all of the above. People are traumatized by what we all went through with COVID. I hear people wiping their dogs' paws and noses when they come and go outside. Don't live in a bubble. Use common sense, especially if you have a vulnerable dog. If you have a puppy, they need to socialize. They need to get out there and meet people and other dogs that are well vaccinated. The vast majority of dogs are surviving if they contract a cough, even the most current one. Make sure you seek your veterinarian's guidance. Treating your sick dog without your veterinarian's help may delay access to important treatment. You don't want to suppress a cough if there's no pneumonia present, and your veterinarian can help you support your dog through the many weeks of coughing that this syndrome may potentially cause. And although respiratory infections should not go back and forth between us and our dogs, it's better to avoid close contact with sick dogs. Wash hands and refrain from kissing your sick dog. Don't panic. The vast majority of dogs cough for weeks. What should you not do? Well, you don't want to suppress a cough. It's your dog's way of expelling pathogens. But if your veterinarian feels that your dog cannot rest and get better without a cough suppressant, then you should have them make that decision. Avoid taking advice from Dr. Google. Rather, seek your veterinarian's advice on how to support your dog and if they even need antibiotics. Don't expose your dog to potential risk factors at dog parks, grooming facilities, or dog shows. Instead, consider a mobile groomer. Have somebody come to your home and take care of your dog. Just use common sense. Don't forget to subscribe and share this video with your friends. Find out more at holisticvetblend.com.